Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Isotretinoin. Introduction. Isotretinoin is an oral medication that treats severe forms of acne, such as nodular acne, when antibiotics and other treatments have not worked. Isotretinoin can cause serious side effects, including birth defects. The only people who can use isotretinoin are those who understand the risks and precautions required while taking the medication and who agree to follow them carefully. This program explains what isotretinoin is. It also discusses side effects you should look for while you are being treated with isotretinoin. Acne. Acne is a disorder of the skin's sebaceous glands that results in clogged pores and lesions, commonly called pimples or zits. Acne lesions usually happen on the face, neck, back, chest, and shoulders. Acne happens when sebum is not able to pass through the hair follicle. Cells from the lining of the follicle are shed too fast and clump together. This plugs up the follicle opening so sebum cannot get through. The mixture of sebum and cells causes bacteria to grow in the plugged follicles. These bacteria produce chemicals and enzymes that can cause inflammation. When a plugged follicle can no longer hold its contents, it bursts and spills sebum, skin cells, and bacteria onto nearby skin. People of all ages get acne, but it is most common in adolescents. Nearly 85% of adolescents and young adults between the ages of 12 and 24 develop acne. People of all races can have acne, but it is more common among Caucasians. Most people no longer have acne by the time they reach their 30s, but some people continue to have acne in their 40s and 50s. The kind of acne usually treated with isotretinoin is nodular acne. This leads to red, painful bumps on the skin the size of a pea or bigger than leaf scars. Isotretinoin and iPLEDGE. If severe acne does not improve with other treatments, such as antibiotics, isotretinoin may be needed. Isotretinoin is an oral medication. It is commonly used to treat severe acne. Isotretinoin is a retinoid. A retinoid is a group of drugs that are related to vitamin A. It works by reducing the amount of oil released by oil glands. Retinoids can cause miscarriage and severe birth defects if used during pregnancy. This is why you must follow all the instructions of a special program called iPLEDGE if you want to be treated with isotretinoin. The iPLEDGE program is a set of monitored guidelines and steps that patients, healthcare providers, and pharmacists must follow. Its main goal is to prevent exposure to isotretinoin during pregnancy. Your healthcare provider will explain how the iPLEDGE program works and what steps you must take to follow it. You will need to sign a consent form to show that you understand and will follow the instructions. If you don't understand what is expected or cannot keep the agreement, your healthcare provider will not prescribe isotretinoin. Men and women who agree to the iPLEDGE program give their healthcare provider permission to register them as users of the medication in the online iPLEDGE system. Women who agree to the iPLEDGE program must have a negative pregnancy test before starting isotretinoin, get pregnancy tests at a lab every month while taking isotretinoin, use at least 2 forms of birth control or not have vaginal sex while taking isotretinoin. You will need to discuss birth control methods with your healthcare provider. You can instead visit with a family planning specialist or a different healthcare provider to discuss your options at no cost to you. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Taking isotretinoin. Follow all the instructions in the iPLEDGE program and the instructions your healthcare provider gave you while taking isotretinoin. Isotretinoin is an oral drug that is usually taken once or twice a day for up to 20 weeks. You will visit with your healthcare provider each month to get a 30-day supply of medication. During the visit, mention any side effects or symptoms you have noticed. Your healthcare provider will determine your dose based on your weight. Your dose might change from one visit to the next. Take isotretinoin twice a day. Ask your healthcare provider if you should take it with or without food. Don't break, crush, chew, or suck on the pills. Swallow the capsules whole so you don't damage your esophagus, the tube that takes food from your mouth to your stomach. Drink a full glass of water with the medication. If you miss a dose, take it as soon as you remember. Skip the missed dose if it's almost time for your next dose. Do not take 2 doses at once to make up for the missed dose. If you are taking Absorica and you miss a dose, just skip the missed dose. If you overdose, call poison control or your healthcare provider immediately. Other medications may cause problems when taken with isotretinoin. Speak with your healthcare provider before using any prescription medication, over-the-counter medication, supplement, or herbal remedy. Call your healthcare provider if you ever have sex without using 2 forms of effective birth control or if you become pregnant or miss your period. In any of these cases, stop taking isotretinoin. Precautions. Wait 1 month after you stop taking isotretinoin to become pregnant, breastfeed, or donate blood. The medication may pass through breast milk and harm the baby. If the blood is given to a pregnant woman, it could harm the fetus. Isotretinoin may make it harder to see in the dark. Don't drive until you know how the medication affects your night vision. Avoid dermabrasion, waxing, laser treatments, and other cosmetic procedures while taking isotretinoin and for at least 6 months after you stop taking it. The medication makes scarring more likely. Avoid sunlight, tanning beds, and ultraviolet light. When you take isotretinoin, your skin becomes more sensitive to light. Make a list of all of your medications and show it to your healthcare provider. Ask before you start any new medication. Don't share your medication with anyone, even if that person has the same medical condition. Isotretinoin can cause problems in people who are not approved to take it. Side effects. There are many possible side effects to isotretinoin, both mild and severe. You need to know about them just in case they happen. Call your healthcare provider if any mild side effects become bothersome. For severe side effects, you may need to stop taking isotretinoin and call your healthcare provider right away. Mild side effects include chapped lips, dry skin, dry nose, and nosebleeds. Isotretinoin can cause serious complications during pregnancy. It can cause birth defects, miscarriage, early birth, or infant death. This is why you must commit to the iPLEDGE program. Isotretinoin may severely impact a person's mental health. Side effects may include depression, suicide, or psychosis. Psychosis is when a person loses touch with reality. A person with psychosis may have hallucinations where they see or hear things that are not real. Signs and symptoms of depression include loss of interest in previously enjoyable activities, sadness or crying spells, difficulty sleeping or sleeping too much, change in weight or appetite, difficulty concentrating. Other symptoms of depression include fatigue or lack of energy, irritability, impulsivity, or anger, thoughts of hurting yourself or others, feeling worthless or guilty, withdrawing from friends and family. This medication can cause pressure to build up in your brain. Rarely, this may lead to death. Loss of vision is also possible. Signs of increased brain pressure include severe headache, dizziness, nausea or vomiting, blurred vision, stroke, seizures. Call your healthcare provider if you have pink eye, conjunctivitis, a skin rash with a fever, blisters, or peeling skin. Also call if you have sores in your mouth, eyes, throat, or nose. If you have any of these symptoms, stop taking isotretinoin. Signs and symptoms of organ damage include difficulty swallowing or pain when swallowing, heartburn that is new or getting worse, diarrhea, pain in the abdomen, chest, or bowels, bleeding from the rectum or anus, yellow skin or eyes, dark urine. Stop taking isotretinoin if you have any of these symptoms. Organ damage may be permanent. Isotretinoin can damage your bones, muscles, or ligaments and cause pain. If you must engage in hard physical activity, or if you have a broken bone, back pain, or joint pain while taking isotretinoin, tell your healthcare provider. Stop taking isotretinoin if you have muscle weakness. This can be a sign of serious muscle damage. Call your healthcare provider right away. Isotretinoin may stop bone growth in teens. If you have trouble hearing or experience ringing in your ears, stop taking isotretinoin and call your healthcare provider. The hearing loss may be lifelong. Isotretinoin can cause problems with vision that can be temporary or permanent. You may have trouble seeing in the dark. It can also cause dry eyes and eye pain. You may have trouble wearing contact lenses during and after treatment. Isotretinoin can raise your blood cholesterol and lipid levels. This could be dangerous. Get regular blood tests and any treatment your healthcare provider recommends. This usually resolves when you finish treatment. Some people experience a serious allergic reaction to isotretinoin. Seek emergency care right away if you develop swelling of your face or mouth, difficulty breathing, or hives. Stop taking isotretinoin. Call your healthcare provider if you develop a rash, red patches, bruises on the legs, or fever. Isotretinoin can lead to diabetes or problems with blood sugar levels. Notify your healthcare provider if you are urinating more than usual or have extreme thirst. If you have trouble breathing or if you faint or feel weak, call your healthcare provider. These might be symptoms of having too few blood cells. Other possible side effects may happen. Talk with your healthcare provider for more information on side effects. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Isotretinoin is a medicine taken by mouth to treat the most severe form of acne that cannot be cleared up by any other acne treatments, including antibiotics. In order to be treated with isotretinoin, you must follow all the instructions of a program called iPLEDGE. The main goal of the iPLEDGE program is to prevent exposure to isotretinoin during pregnancy. You will need to discuss birth control methods with your healthcare provider. You can instead visit with a family planning specialist or a different healthcare provider to discuss your options at no cost to you. Isotretinoin can cause serious side effects, including birth defects during pregnancy and mental health problems. You need to know about possible side effects just in case they happen. Call your healthcare provider if any mild side effects become bothersome. For severe side effects, you may need to stop taking isotretinoin and call your healthcare provider right away. You will visit with your healthcare provider each month to get a 30-day supply of medication. During the visit, mention any side effects or symptoms you have noticed. Your healthcare providers are available to talk with you about isotretinoin and to answer any questions you may have. Thank you for using Explain.